There is research around a phenomena and a behavior called climate anxiety. And it's real, and it can be diagnosed. But when we live in that, when we're living through these extreme heat phenomena, which are more frequent now, we as a community can become anxious. I in my house can become anxious about what's next.
The American Psychological Association has been researching the effects of extreme heat and how we respond to it. Elaine Johannes, the Kansas Health Foundation's Distinguished Professor of Community Health at Kansas State University, says the findings show that prolonged extreme heat events can put the mental health of some people at risk. On today's Sound Living, climate anxiety. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. According to Johannes, prolonged extreme heat has a cumulative effect: anxiety, less sleep, and less balance in our diet and daily routines. This can make us more irritable and impact our cognition, meaning our thinking is somewhat limited. Then we may also become aggressive or argumentative. Elaine, we're in that time of year when the temperature just seems to get hotter and hotter, humidity goes up, and it has an impact on not only how we feel, but sometimes how we act, because it does affect the mind.
Yes, Jeff, yes. And I think all of us agree that the duration, the intensity, and the frequency of these hot spells, which FEMA calls extreme heat, these extreme heat periods are becoming more frequent, more intense, and they're longer. So maybe some of us have observed our family members, the children, the people in our communities seem maybe to be a little bit more irritable or argumentative or less likely to even be sociable. People are staying in, hopefully, where maybe they do have air conditioning. The American Psychological Association has done quite a bit of reporting on what does extreme heat do to us or how we respond. And Jeff, you're right. There are the responses of humans seem to be more irritable. If we aren't acclimating or not coping with the heat, we may have some cognitive changes in abilities to really think straight away, and also how we might isolate ourselves. Some of the physiological responses to these heat durations are insomnia, lack of appetite or changes of appetite, and also some isolation. The Surgeon General released a report about 2 months ago about the epidemic of social isolation in the United States. And in that report, it mentions some climate effects and climate change. So if we are having these longer durations of extreme heat, we don't want to be around other people. We want to kind of be where we can make sure that we're cool. But when we look at some of the data trends, here in the Midwest and in the Northeast and the Northwest, we've had these long heat spells. And if people don't have access to air conditioning, if they don't know where to go, if there's not a cooling center in the community, then where do people go to cool down? And there are vulnerable people in our community, those who are younger, children who really don't have the heat regulation or the body temperature regulation abilities all developed yet. And then on the other side of the lifespan, we think about older adults. They can't really regulate their own temperatures that well. They're at risk. And then right smack dab across the whole lifespan, people that are on prescriptions, the people that are either on hypertension prescriptions, diuretic, diabetes prescriptions, people that are taking what are called the psychotropic prescriptions, helping them acclimate when they're having a mental health concern. Those are always coupled with don't stay out in the heat. But how many of those warnings do we really know? And we really understand how persistent heat, without cooling down, without having enough water, not beer, not alcohol, not pop, water, hydration, and how that all affects our cognition and then our attitude.
And then when we tie in just general anxiety on top of this, that's another layer added on, right?
Yes. Anxiety is not just that occasional worry that I think all of us can say, yeah, I've been worried about something. It's kept me up at night once or twice. But when we have what's called generalized anxiety disorder, Maybe it's diagnosed and we're on prescription for it, or maybe it's not. Maybe we are persistently anxious, worried, thinking about things that are problematic. That anxiety can extend also into what we're anxious about. And of course, with the news about climate change and then, these floods and kind of extreme weather patterns. And the more we tune into that, there is research around a phenomena and a behavior called climate anxiety. And it's real and it can be diagnosed. But when we live in that, when we're living through these extreme heat phenomena, which are more frequent now, we as a community can become anxious. I in my house can become anxious about what's next. What is the effect of that on my garden, on my animals, on my livestock, on my crops, on my community, on my household, and on myself? That anxiety amplifies how we behave. So back to this American Psychological Association report, they have tracked and they have given enough information about, the more anxious we are, the less sleep we have, the less balance we have in our diet and our daily routines, the more apt we are to be irritable. And if we become irritable and our cognition, meaning our thinking, is somewhat limited, then we may become aggressive, we may become argumentative. And I think we've seen that in our families and our households and our communities.
Yeah, I think we see that on the news where there's a fight that breaks out for no apparent reason other than the fact that everybody was hot, frustrated, and irritable.
Yeah. And there is a phenomenon called the heat islands in urban and metro areas that have cement, a lot of concrete and buildings. So when you look at sociological data, again, those kind of argumentative acting out, look at the time of year, summer, look at the temperature, look at the trends. And by the way, the Kansas Department of Health and Environment tracks that through an environmental tracking data system. So when we think about in the heat islands of urban areas, and we think about the number of emergency visits or hospital visits that are from urban areas associated with heat, look at what's happening. But how do we cope with it? Well, getting out in nature, enjoying, but if it's so hot, how do we do that?
It can be difficult. I remember seeing just not too long ago about people kind of making fun of people in England because they were concerned that it was 75 degrees and people couldn't understand how that could be an issue. But it's what you're used to because for them, 75 and humid is highly unusual and they don't have the air conditioning.
Absolutely. When we look at what the people in the Southwest part of the United States, the southern regions, Texas, even in Florida, they have lived in heat environments that I know I wouldn't be able to acclimate to. But when we think about as these heat incidences keep creeping up northeast, Europe, you've mentioned that. In England, we looked at what happened in 2023 in the Northwest, in Oregon and Washington. When it becomes so hot and people aren't accustomed to it, nor their buildings, their houses, their workplaces equipped, and people are still expected to perform their daily chores, it's difficult. And it becomes difficult, especially when people are accustomed to being outside, having either physical activity, those sporting events, or just being outside to get to one place to the next, and they enjoy walking or, just what's going on in nature. If nature is affected and our ability to be outside is affected, and then we don't find any kind of reprieve inside, if we have family members who can't afford air conditioning, or family members who live in a place where the air conditioning doesn't work, or we live in a community that there are no cooling facilities, it can be a cascade of things. And then stir into that pot again people with a health concern, people who are either diagnosed and they're on prescriptions and they really should be not overheating, because their body core temperature can go up if they don't manage that prescription with the environment, with their own health concerns well. But also what happens when the person is undiagnosed. They may be having some mental health concerns or hypertension concerns, and they don't have a physician or a health provider who's diagnosed and keeps them on a regular prescription that helps them kind of regulate their core body temperature. It can be a cascade of things where older adults, especially younger children too, and then everybody in between are really at risk.
One of the publications had 6 tips for coping with climate anxiety, and number 1 was just kind of focusing on things that you can control. As we mentioned, sometimes there's a lot of things you can't control.
Yes. I think about our friends who are tuned into social media all the time, or even that 24/7 news. That can be anxiety-provoking itself, let alone a general anxiety disorder that we have. So, yeah, focus on what's doable. And that means from an individual standpoint, understand when we're starting to overheat, take action, seek shelter that's cool, and drink fluids that are appropriate. Be aware of how your prescriptions affect your core body temperature. Manage yourself. Focus on what you can do. Focus on even what you can do maybe in planting a plant around your house or out in the garden to regenerate some kind of green space that you feel, I can focus on that. One of the other helps, of course, is don't overload. And what that means, I think, from a personal perspective, is don't overload your daily activity. Now, if you have to be out and harvest or take care of the cattle or being outside, okay, manage that. Try to be away from those hot core hours of the day, which is usually anywhere between 10 a.m. and 2 or 3 p.m. The advice given is also don't overload your responsibility that we take on to correct climate change or correct things. Make wise decisions on what we can and can't do. If we take on too much, assuming that it's my responsibility, it can be overwhelming and create more anxiety.
Yeah, I thought it was also nice to talk about compassion not only for yourself but others, but the having compassion for yourself, because I think sometimes we're harder on ourselves than we are others.
Yes, absolutely. One of the other steps then that what is recommended by the University of Colorado is have compassion for yourself and others. Kind of tamp down that irritability. Take time to breathe, deep breathe. There's a technique called the box breath, which allows somebody to take in 4 big breaths, hold it for 4, count of 4, and breathe it out for count of 7 and 8. That actually has some psychological and physiological benefits. So my mother would say, count to 10, when I was starting to be argumentative. And, that's wise. Count to 4, breathe in. Hold 4, then count to 8, and that kind of comes out to 10. And Jeff, one of the things about being compassionate is being compassionate, especially when you watch the news. That was one of the other steps that they recommend. Take a break from how bad it is. And unfortunately, most news feeds portray things to be in dire situations, especially around heat or weather or natural disasters. They are serious. They are of concern. We don't diminish that great harm that they could do, but we need to focus on what we can do and not what we can't.
The other two kind of go hand in hand. That is remembering that you're not alone and talking to someone about how you're feeling.
Mm-hmm. And when we feel alone, we kind of get so centered in on no one else understands. But that's the reason why the Sound Living podcasts exist so well and they reach so many folks. This kind of discussion we have allows us to not feel alone and to allow us to comment on, I'm feeling irritable. I'm feeling unwell. These heat incidences are really, dragging on. And maybe it is not only anxiety and worry, but maybe it is a biological, physiological response to the heat, and our core temperature isn't regulated. And we aren't managing it well when we aren't managing our prescriptions and our own acclimation to the heat. We can't ignore it. And so we need to talk with each other, have compassion, and then reach out when we know that heat is at risk.
That's Elaine Johannes, the Kansas Health Foundation's Distinguished Professor of Community Health at Kansas State University. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.